Global Nutrition Cluster and the Sun Movement Secretariat. You might have seen on your screen that this webinar is recorded, and you will be able to access it later on the website of the Global Nutrition Cluster and the Sun Movement Secretariat probably as well. I'm Catherine Chazali. I'm an independent expert. I have been working in the field of nutrition for over 20 years, and I'm very happy to welcome you today for this webinar on the humanitarian development nexus and how we can make it work. It is a rather challenging topic, but it was a very interesting one, and it allowed me to meet a lot of very interesting people. Now I would like to invite Gerda Verburg and Stefano Fedele to open this webinar. Gerda is a UN Assistant Secretary General and the coordinator of the Sun Movement, and Stefano is the Global Nutrition Cluster coordinator. Gerda, the floor is yours.
Thank you very much, Catherine, and let me first commend you for a great job done. With this study with a lot of good and pragmatic recommendations. And let me also recognize the support of USAID for making this possible. But having said this, it goes without saying that it requires all of us to implement the recommendations at country level. And if there is a time that it's more important and more crucial than now, I cannot think of it, because COVID-19 is really teaching us that we need to work hand in hand, come together as humanitarians and development people, and work hand in hand at every phase of this and other crises. First of all, to make sure that nutrition is involved in any emergency package. And could it be that the people involved and impacted are involved in the approach? Secondly, to make sure that it will be an automatic part of the parcel of the next emergency, so that it is systemically brought in the emergency steps that any government or any governing body is taking when a crisis arrives. Then it is important to make it a part of the recovery phase and to build back better. And there we have exactly the need for the humanitarians to come in very strongly and very quickly. But at the same time, they need to realize that there will be a moment that they need to hand over in a warm way to the development partners. And could it be, I am a farmer's daughter, could it be the humanitarians are already planting the seeds for the next harvest that the development that after the recovery or during the recovery can be harvested. Having said this, I have seen the recommendations you made. As I said, they are very pragmatic. We as Sun Movement are finalizing the strategy for Sun 3.0, but in this, the collaboration of all partners at the country level, the civil society, the UN, the donors, and where available and where active, also the private sector. We will support it very strongly, and we will try to connect the Sun Movement network as soon as possible with the humanitarian and the development, making them part and parcel also of this nexus approach. And of course, we need to recognize the contribution of each of the partners, and I can also read this. Don't forget to recognize and praise the work of the humanitarians once you are going to harvest or see the fruits of the collaboration. Both is important, humanitarians and development, especially if they work hand in hand. And I will certainly do this in my job. I've also seen your recommendations on the strong advocacy at all levels. And that's also something that I will take on board. But let me emphasize here one thing that is crucial right now. The Sun Movement has many countries that are in a fragile or conflict-affected situation, and actually all countries are now in a fragile situation because of the COVID impact. There, it is even more important that the non-governmental partners are working together and are aligned in order to push the government to take a better approach vis-a-vis the government, vis-a-vis the future. And where the government is not stable or not able to do it, prepare the ground for them. Furthermore, I will also make sure that in my outreach and connections with countries, resident coordinators and humanitarian coordinators are really leading this, propagating, but also encouraging the nexus where they are in the lead. And having said this, I praise you all for coming together. I know that it has taken a while to get here, but now we are now we are here, and we look forward and we see the urgency. Let us make sure that within a few years from now, we have documented impact of the outcomes of these recommendations, where we can be proud of, that we can share, where we have clear indicators for other partners and other situations to learn from, so that we can do the cross-inspiration, and building upon this outcome, we can make the humanitarian development nexus a thing of the future and a discussion of the past. Thank you so much for having me.
Thank you, Gerda. Stefano?
Yes, thank you very much, Gerda. It's great to be able to collaborate so closely with the Sun Movement, and I hope that this is going to be one of many other opportunities for very close collaboration and be able to guide jointly how we can strengthen the humanitarian development nexus for nutrition. This is very much at the heart of how the Global Nutrition Cluster has been working, and especially in prior to COVID, already the Global Nutrition Cluster had as an objective to strengthen sectoral coordination for nutrition in every country which may benefit from it, to ensure that there is greater strengthening of coordination of nutrition prior to, during, and after emergencies, to address malnutrition in all its forms, not only that when a crisis already struck. So this is this has been very much part already of the priorities of the GNC prior to COVID. The COVID global pandemic has given us the opportunity within the crisis to actually accelerate this process, and the Global Nutrition Cluster is now supporting 63 countries affected by COVID, even countries where the cluster coordination is not has not been activated. And this work needs to be done in close collaboration with all partners, chief among them the Sun Movements, to support national capacity for sector coordination, to have greater ownership not only of the problems but also of the solutions. Now, so we hope that all partners and stakeholders working in either or both development and humanitarian field can effectively capitalize on the study's recommendation to come together and achieve better results for the most vulnerable. And as I mentioned, we have been linking humanitarian development approaches already for some time, but it's really important that we do so in a more systematic and structured way. And we will ensure that the study's recommendations are incorporated into the Global Nutrition Cluster strategy and in our advice to the country level for actual, because that's where the results actually take place. So again, thank you very much also to Catherine for the great job done, and also to USAID that whose grant provided the funding for the work. So thank you very much.
Thank you very much, Gerda and Stefano, for this introduction. The webinar is going to organize in two parts, a presentation of the kind of preliminary findings and key recommendation, and then some group session to discuss more specifically the recommendation. So I will go straight to the presentation. I will try to be short, so like this we have more time for the group discussion. So I don't have to remind you of the importance of the Nexus. I think Gerda and Stefano did it. I'm just trying to move my presentation. Sorry. Here it is. So just in a very few words, the methodology around this study. So it's based on 3 country case studies, Niger, Afghanistan, and Myanmar. The objective of the studies was really to look at how the Nexus works for nutrition, how could it work more efficiently in a very pragmatic and operational way. It was done mostly through a review of existing information, as well as key informant interviews and focus group discussion, mostly key informant interviews, because the whole study was done from July to September remotely. So unfortunately, it kind of, yes, I could do only remote interviews. So also, it means that it limited also the representativity of the panel of key informants, because I couldn't use a translator, and it was also difficult to reach people during this particular time. So we hope that the report will be finalized by the end of the month, by the end of October, and we will organize more webinar next month. You receive a draft report already, and we are inviting you to share the comments. So for this particular study, the humanitarian development nexus was really understood as a central point where humanitarian and development actors are linking up to address more efficiently the needs, the nutrition needs of the population. So it's really about kind of bridging humanitarian and development actors and linking efforts. So, and the nexus was understood in terms of really its objective, in terms of improving the coverage by ensuring the continuum of services for women and children, in being able to improve efficiency by linking prevention and treatment, preparedness and response, and reduce humanitarian needs, as well as supporting human development. So in this broad sense, and then also in being able to reduce the cost for intervention in terms of being able to deliver more by pulling resources together. So it's really about this idea of linking up humanitarian and development programs and actors to be able to do more, to impact more on nutrition. So the key findings, very quickly, I'm looking also at the time, sorry. So the key findings, very positive points. There is, in the 3 countries which have been studied, there is a very strong political commitment for nutrition. It resulted in the development of policies, strategies, and coordination mechanisms which are quite active and conducive. Policy strategies and particularly multi-sectoral policies have been developed in these 3 countries with the support from the Sun Movement. And they have been also accompanied by a strategic plan. Also in these 3 countries, we can see that there is a collocation of humanitarian and development actors in some priority areas. And also in the public health systems in support to nutrition treatment, to the scaling up of IMAM and CMAM. There is also in these 3 countries an increasing flexibility from the financing instruments on both sides, from development as well as from humanitarian side. These 3 countries, like Gerda was mentioning, are fragile and conflict-affected countries. So this study really focused on this particularly challenging context. I see that somebody is raising a hand, but I think I will leave you some opportunity to ask for clarification questions just at the end of my presentation. So if we are looking at the kind of more the gaps, let's say, there is no shared vision of the humanitarian development nexus for nutrition. There is some development of concept and vision, shared vision around the triple nexus, around the overall humanitarian development nexus, but not specifically for nutrition. So this process is already started, but it needs to be a bit more focused on nutrition in terms of understanding really what the nexus could bring in terms of nutrition outcomes, as well as which could be the area of convergence between the humanitarian and the development actors. This is not really kind of clear yet in these countries. There is also clearly a lack of investment in nutrition in these countries, as well as lack of investment in terms of disaster preparedness. And it means that the commitment and the plans which have been developed, the multi-sectoral plan especially, are not implemented at scale. There is a certain level of implementation, but it's more opportunistic, related to opportunity that government and ministries could find corresponding to the priorities of some donors. But it's not systematic, it's not purposive, it's not prioritized, and it's definitely not at scale. Also, what the study found is that there is still a very, very strong silo between humanitarian and development actors in terms of the way they are working, the way they are also just exchanging or coordinating their activities. Between the central level, the national level, and the subnational level, there is a lot of silo in terms of the exposure to the nexus concept, to the exposure to the different debates around nutrition, to the also involvement in terms of the strategic discussion. There is quite a lot of differences between the central and the subnational level, between UN and civil society organization, also in terms of access to resources, capacity to participate also in the different groups, in the different process, and among in general sectors also and institution. So this was the kind of main findings for the study, which are kind of detailed in the report. And I'm moving quickly to the recommendation. The recommendation will be discussed. If I could, why can't I should, voila. So, so really the recommendation that we will discuss more in detail in the group work are really mostly around developing a common vision of the humanitarian development nexus for nutrition, specifically for nutrition, around prioritization to be able really to support the implementation of this plan, and of the different plan, humanitarian and development plan. Increase the participation of the local actors. The local actors really are important players in terms of implementation, in terms of disaster preparedness, response, but also in the implementation of the development program, and they are not sufficiently present yet. Also supporting common coordination platform to be able to reduce this silo, looking at more shock responsive policy and programs, and at more result and accountability. So this is really kind of the main recommendation. So we will, after this presentation, we will divide you into 5 groups. Unfortunately, due to technological limitation, you cannot choose your group, so it will be done randomly. And we will ask you to look at the detailed recommendation, which are in five main areas. So the first one is really on developing a shared vision of the humanitarian development nexus for nutrition, in order to support the operationalization of the nexus. Then the second one is to be able really to create a space, so concretely to create a space for humanitarian and development actors to link up, to meet, to work together, and to increase the participation of the local actors. The third one is to support the implementation of the multi-sectoral plans, which are really representing an opportunity to build this nexus, because they are covering the kind of whole spectrum of nutrition. So they are really representing a very great opportunity, but unfortunately, their implementation is not at scale yet. And so it needs to be prioritized. And also to include more the humanitarian and the local actors, which can really help in the prioritization exercise, but also in the implementation. Then the fourth one is really around defining responsibilities for disaster preparedness and response, which are still very much falling on the humanitarian actors, but which is also an important responsibility for the government. So how could humanitarian and development actors work together on this? And then the fifth one is on improving the participation, how to have more active participation in this process in terms of coordination, building the nexus. And this, from the case studies, the findings are that it has to go through strengthening the accountability, being able to demonstrate results, and really strengthen the engagement. So now very quickly, if you get some burning question, I can take them, but if not, I think I will propose you to go to the...
So Catherine, there were actually quite a lot of questions with the clarifications.
Okay.
I can briefly maybe read, and you see which ones you can answer during this time, and maybe we can write a response to the remaining if we don't have enough time. So would you like me to read all of them to you?
No, maybe do you think there is any burning one, Anna?
Yes, there seems to be for the clarification, for example, what was the criteria for the selection of the countries, how the COVID-19 was reflected in the countries, how did we measure political commitment for nutrition, what was the common SGN understanding for the countries, and so on.
Okay, maybe just I can clarify a few points around the methodology itself, and then after for the question which are more related to the nexus itself and to the humanitarian development collaborations, then we can discuss it in groups. Regarding the methodology, so the country were selected, these countries are fragile and conflict affected countries. It's countries where there is already process which started. So they were really selected based on their interest. And also there are countries which have been willing also to welcome this study as a way also to improve their own country processes. So also for your information, but I also provided specific recommendation to each of these countries, and they have been discussed also with them. And for the Nexus, I think it was what I was explaining at the beginning of the presentation. It's really understood as a kind of central point where humanitarian and development actors are linking up to be able to improve nutrition outcome. So it's really about kind of finding areas of convergence where humanitarian and development actors can work together to bring greatest outcomes. Is it covering it more or less, Anna? Or?
Yes, so there is a number of the comments which we won't be having time to go through, but we will take the notes, and then if some of them would require the response, then Catherine would reply personally to each person, because we do have all your emails. And Catherine, I'm ready to send everybody to the breakout rooms, if that's what we want to do now.
Yes, I will. I guess that so you will go to a group, and the facilitator will be facilitating the group and will be explaining you what we are expecting from you. But basically, what we are expecting from you is to look at the set of recommendations, clarify them if necessary, look at, give a feedback on their feasibility. They are divided by area, by responsibility. So please also provide us with a feedback on this, and also do not hesitate to complement them if you think that there is also big gaps.
So we are on time. I hope you all had a very good discussion in your breakout rooms. Just to close the session, in terms of the next steps, as I mentioned, the report is open for comments via email directly to Catherine until the 2nd of October. All your comments are confidential, so please feel free to write directly to Catherine without copying us. We are planning by the end of the October that report and all the case study and the policy brief which will accompany this study to be finalized. And in November, we are planning for regional webinars in English and French, where we would be involving simultaneously nutrition clusters or nutrition sector representatives, and also some focal points in countries, so that they will be able to communicate and to have a discussion based on the recommendations and how they can take this forward in their particular countries. It's likely that those regional webinars would be recorded and posted on our websites, so you would be able to participate in this, you would be able to listen to the discussions, but you would also likely share the summary of the regional webinars. Now, in terms of our commitment, as everybody, including Catherine and including Stefano and Gerda emphasized, both of us, JNC and SAN, are committed to take the results of this study forward, and we will be working together to see how best we can implement the results of the report, and obviously we will be consulting you all throughout the whole process. Stephen?
Yeah, thanks. I think you covered most of the points. Just again, from the Sun movement perspective, I think that we heard from Gerda at the beginning that we are committed to making this work. I will touch upon a comment that Purnima from the UN Network for Nutrition made, is that there has already been a lot of work that has been done with the cluster since 2017. There's been notes from Stephen O'Brien, the Emergency Response Coordinator, and from the development side of the UN, to resident and humanitarian coordinators to try and promote the Nexus. And I think we are committed. I think that the COVID crisis has given us another big push and incentive to make sure this happens. Hopefully that incentive will also be translated for the country stakeholders. And as I said, this this particular study and this particular round is obviously to build on those recommendations and reports, but I think really to try and get down into the countries and really listen to the stakeholders in the countries to try and see what blockages there are, or what roadblocks, what hurdles there are in country, and that we can together, global, regionally, agency by agency, really move towards removing those and make sure that we are more lined up, more linked up than we were before. So I'm really looking forward to the regional webinars to share this with the countries, but also then to, between, I guess, the Global Nutrition Cluster and the Sun Movement, with inputs from focal points and nutrition cluster coordinators, to choose a few countries to start working with, and then just continue working country by country to really make sure that we give the support that's needed to try and make the Nexus work for the people that need the assistance. Thank you very much for participating. I think that comments, yes, can still come in until 2nd of October, and we hope to share with the final report as soon as by the end of the month, I think end of October. Thank you. Stefano, I don't know if you want to close it. Gerda has unfortunately had to leave us.
Thank you very much. No, it's a pleasure, and it's really great to hear as well so many comments, and I totally agree as well that there is. I mean, this is not the beginning of the narrative, and but it's certainly a good point that to reassert our commitment, and joint commitment to work together with all the partners to strengthen the nexus between humanitarian and development. It just makes sense. There is no other way to go around it, and we need to increase also the flexibility of whatever approach we develop, because the situation keeps changing rapidly. The response to COVID has been, a lot has already been achieved in the last few months, but we don't really know what the future holds for us. So for the world, and we need to ensure that we maximize every opportunity we have to reduce the vulnerability of many groups and many countries. So looking forward to the continuation of this discussion with many of you, and really to use the report recommendations to guide our future work, in particular at the country level, and in strong support of national capacities. So thanks a lot. Goodbye.
Thank you.
Thank you very much to all of you for your participation. Thank you.
Bye.
Thank you. Goodbye.